Hi, and welcome to Coping with the COVID Crisis. I'm Janet Gross, and of course, as we hear of some countries beginning a new normal kind of return to school and work, and we have promises and rumors of here at home of getting back to life outside the house, we're still dealing with stay-at-home orders, being unsure of what's happening next. It can all add up to a lot of increased stress, depression, the feeling of having no control over anything. The University of Holy Cross has been and still is pitching in to help with that by listening and counseling and by, quote unquote, being there. Well, I'm Dr. Roy Salgado. He is a professor of counseling at the University of Holy Cross, is here to talk about what they're doing and how it might help you. Thank you for joining us.
Thank you very much for having me.
So, okay, there is a new service. I mean, it's a service that the University of Holy Cross has been doing for a while, but it is changed in its form to really reach out to the community. Tell us what's happening.
Yes, as part of the mission of the University of Holy Cross, we've been there providing services to the community for decades now, providing counseling services and mental health services. What is unique about what has happened since COVID is that we've transitioned 100% to telemental health. And so we've given the training and the requisite training to our students to be able to reach out to the community so we can provide that consistency of care and that continuity of care to the people of New Orleans and Louisiana.
And so they can do this from the privacy of their home. It's
free of charge.
Free
of charge, yes. That's part of the mission that we really want to, as a community, still be there. We realize that these are difficult times for all of us, everyone in the world. And so this is a way that we can contribute in being able to bring some normalcy to the lives of people and let them know that what they're experiencing is not unique to them and that we're all going through it at the same time and that we're there to listen and to be there for them.
And I got to figure now, especially, people want somebody to talk to. Some people are in total isolation.
Absolutely.
And really are going through things that they may not be able to handle by themselves.
And that's why it's important. We realized that we couldn't just close up shop and shut down once we all were asked to cloister and hunker down. Mm-hmm. And we had to continue to provide this service to individuals, not only our existing clients, but we saw the need for other people who would perhaps had not been receiving services, who would find themselves in the need to seek services during such a challenging and unprecedented time.
I'm wondering, do you think it also helps for people who have never been to a counselor, who have never done anything like this, if they really need it and they're sitting at home, they don't have to go to somebody's office?
Right. It's a process that takes people some time to get used to, to make yourself vulnerable, to go and talk to someone, to make that initial call and say, I need help, and maybe professional help might be of benefit. This, for some individuals, could actually be something that would prompt them to reach out and say, I need help and it's available to me. I don't have to even leave my home. I can just make a call, sign up, and receive services and know that somebody's there to listen to me. And especially that it's free of charge. this is something that if money had been an issue for individuals in the past, right now the service is there for them as a gift to the community.
So how, you mentioned you just call, you make an appointment, and then somebody calls you back? Is that how it works, or?
Yes, individuals can call our number, and they would be connected with the administrative assistant to the director. The director triages the call and assigns them to a counselor in training. Then that counselor in training would set up that first appointment, and they would be able to go from there and receive services.
Okay. How overall do you think, you've been doing this for weeks now, so what is your feeling about how people are doing in this situation?
Well, people are stressed. They are very stressed, and the uncertainty is unsettling for everyone. And some people are handling it in stride, others are having more of a challenge. And so that stress, that uncertainty, that anxiety is producing fear in people. And so they're reaching out, asking for tips and ways to cope with their experiences. They're with their families, they're becoming teachers and teaching their students at home and all sorts of things that they are challenged to do that they hadn't been challenged to do in just a few short weeks prior.
Mm-hmm. So if people call up, they can just tell kind of what their need is, and then that helps to assign?
Sure, yes. The administrative assistant takes the initial call and does a pre-screening, and then that screen gets sent to the director, and there's an initial intake that takes place. Then that information is passed to and assigned to a counselor, who will then reach out and provide the continued service on a week-to-week basis
How
with the
long
individual.
are the sessions?
They're 50 minutes long.
50
So each session is 50 minutes, and it could be telephonic, just audio, old school, traditional, on the phone. But we also have the technology and the capabilities to do telemental health, which is audio-visual communications. So you can see the individual and look at their expressions and be able to assess their state in a given moment.
Telemental, kind of relatively new? Yeah.
Relatively new in the world scene. It's been around for about 10 years, perhaps not as widely used as it has been in the past month, but it has been around for quite some time. And with requisite training and with the guidelines that are set in place that have been in existence for some time. But right now, many people are receiving these services.
Do you think that's going to be a continuing thing as we go into the new future?
You know what? I think the genie's out of the bottle. I think now that we have issued this new era, nobody asked for it, but it just came. And people are receiving the trainings. Professionals are receiving the training to follow the guidelines associated with telemental health. I don't know that everyone is going to go back. I think that we'll have both and. We'll have both people that are interested in face-to-face service, but also those now that are more comfortable or for all sorts of reasons that are more interested in telemental health. Other than convenience, it is a very cost-effective way of receiving and providing services.
Okay, in fact, we're going to talk about how this all came to be and the training involved and everything else in just a minute. We're going to take a break. We'll be right back.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Welcome back to Coping During the COVID Crisis. We're here with Dr. Roy Salgado from the University of Holy Cross, and we're going to add one of your colleagues, actually the Dean of the College of Counseling, Business and Education, Dr. Carolyn White. Thank you for joining us, in this new world of teleconferencing. We have her on Zoom, so thanks for joining us.
Thank you.
Okay, Doctor, I know Dr. Roy and I were talking about the quick change that this all took to get this together and to make this happen with your graduate and doctorate students. So can you help us go through how that process happened? Because it had to be a quick change.
It was very quick. We realized that we were going to have to do this if we were going to continue to provide services for our clients and provide the training for our students through the rest of the semester. So Dr. Salgado had the training for the telemental health, was willing to quickly put it together for our students. We actually put it together in 2 days' time and had wonderful response from all of our students, all of our faculty. So we had 2 days of training on a Friday and Saturday. And on the following Tuesday, we launched. And everything was from home, and students were calling their clients. New clients were calling in to the center and getting our administrative assistant, who was taking the initial information, passing that on to our counseling center director, and he was assigning clients. So it's worked very quickly and very well.
And this is like 80 doctoral and master's level grad students who are doing this, correct?
Yes, yes.
And it's mandated by the state, is that right? You have to have this training. It's not something you could just leap into and go, okay, you have to know this.
That's correct. You need the training to be able to know how to deliver the telemental health.
Is there a lot of difference, or how?
Well, there's guidelines that the state has in place, because you have to keep in mind that when a professional gets licensed, they get licensed in a state. They don't get licensed nationwide or worldwide. So there's a lot of ethical and legal components in terms of jurisdictional issues that ought to be taken into consideration. as well as specifics with regard to some of the more advanced clinical practices with regard to how to handle a crisis when the client is not there with you. You know, there are certain parameters, certain things that need to be taken into consideration. So there's a whole depth of training that needs to be taken and things to be taken into consideration in order to deliver the service most effectively.
I know people are thinking, okay, these are grad students and these are, you know, doctoral students, but the word students might, you know, think, oh, who am I talking to?
Sure. You know, we refer to them as counselors in training because they're professionals. These are adults. They have the requisite theory and technique and practice under their belt. Now they're in their practicum or internship. 700 hours of required work necessary in order to be able to provide services. They're doing it under the supervision of their faculty, and they're in consultation with the rest of the faculty. So, you know, students in any field, whether it's mental health counseling or medicine or nursing, they are under the supervision of licensed professionals in their respective fields and delivering services. This is no different.
Dr. White, I guess this is an incredible opportunity for them as well to have a lot of training, because I'm sure that this program is very popular now.
It's intense, and that's one of the reasons why they need the additional training, as Dr. Salgado said, for the telecounseling. Our students are really well prepared. Their first semester they have to do in the counseling center, and then some of them continue in the counseling center, and of course now they're all continuing, you know, through the counseling center. But they can also go out to agencies within the city, and they do that in normal times. So even if you're at a different agency, you may have a student intern, you know, who's providing the counseling for you.
But there's someone else helping?
Time.
There's somebody like who's on call to help them if they have an issue or if they have a certain circumstance?
Yes, absolutely. The director is always, whenever they're doing any of the counseling, the director can be called in now, can join into a Zoom session or into a phone, you know, they can conference in if they get into something that they really aren't sure exactly how to handle. They can call him in and he's available the whole time that the counseling center is open. They also have additionally faculty supervisors who are licensed professional counselors, as is the director. So, you know, in the event that there were two things going on at one time, you could have a supervisor also calling in to another session while the director was, you know, in. That doesn't happen that frequently, and it usually happens when there's a crisis, you know, a client who might say that they're suicidal, or, you know, that they're harming themselves or thinking of harming themselves. A lot of times that's when, you know, a supervisor or the director will join in just to make sure that that client gets the services that they need. Okay. But most of the time our students can handle whatever comes their way. I mean, they're well trained. They're very well trained and well supervised.
Okay, thank you, Dr. White, for joining us and helping us kind of learn a little bit more about this program and the service that the University of Holy Cross is providing for the community, and even a community that extends beyond the university's radius, really.
Absolutely. This is something that's open to individuals in the state of Louisiana. You know, we have jurisdictional license to be able to practice within the state of Louisiana. And so individuals who live in other parts who are interested or who find that they're in need of counseling services, this telecommunications opportunity to be able to receive this type of service is available.
That's great. Okay, well, we're going to take a quick break, and when we come back, we'll talk more about coping during the COVID crisis.
The Willwoods community prays for the safety of healthcare workers, and we thank them all for their dedication and service during this COVID-19 pandemic.
To those on the front lines in hospitals, clinics, nursing homes, and testing centers, we thank you. We thank you for answering the call. The stakes are high and the challenges innumerable, with harsh conditions and no second chances. Yet our doctors, nurses, technicians, transporters, EMTs, pharmacists, and everyone who supports patient care are rising to the occasion, healing and caring for the most vulnerable in our community. You are our heroes. Thank you for the sacrifices you make every day, and especially during this pandemic. Your dedication, commitment, and courage deserve our deepest gratitude and admiration. It's with your help we will all get through this.
Welcome back to Coping During the COVID Crisis. We are talking with Dr. Roy Salgado with the University of Holy Cross, and we're also going to bring in the president of the University of Holy Cross, Dr. Stanton McNeely. Thanks for joining us, Doctor.
Thank you, Jan. It's a pleasure to be here with you.
You know, this is a great service that you're offering to people and people across the state. I know that Dr. Salgado said that this is also something that you're teaching other people to do. The teaching process is being offered to other people. So what a great service from the university. And I know that the university is no stranger to helping out in catastrophes or disasters, things like that, because I know during Katrina, the facility itself stood in for, you know, a lot of people.
Yes, absolutely right, Jan. This is truly our mission in action once again, of course, during challenging circumstances in our larger world. And the university was founded by the Mary Knights of Holy Cross 104 years ago, and their mission is to be a prophetic presence in an ever-changing world. And as we live our mission, and in various ways, of course, in normal times with effectiveness in teaching and learning and having our students learn from expert faculty like Dr. Salgado and others in various programs, and they go out and serve in service to others in the community, but especially during challenging times, like we did during Hurricane Katrina with housing our first responders, and what we're doing now. I'm so thankful and proud to our counseling department, Dr. Salgado, Dr. White, and all the faculty and staff, as well as, of course, our students who are getting their education in a different way than perhaps they normally would, but then also in the process, they're a prophetic presence in an ever-changing world. And I'm so glad that we're living our mission and this time to serve others and also continue the education of our graduate students in counseling.
There are a lot of people who need help at this point, and you're right. If it's as easy as a phone call and it's free, that has got to be a big advantage to a lot of people.
Absolutely right. And that's the thing, is the Father Tom Chambers Counseling and Training Center has been providing counseling services along with the education component for our graduate students for over 20 years. And it's been always a community service to the larger public with a nominal fee. But we jumped into action, and again, thanks to our faculty and leadership on this, to waive that fee right away, but also provide through this telecounseling service the opportunity for our graduate students to continue their education, but then have a broader reach. Even while the physical campus is not accessible, we're broadening our reach, like you said, Jan, to the greater New Orleans community, to the state, and that way we're able to serve more people in this critical time.
You know, let's talk about how obviously school is shut down, you know, by going to the school, but physically, but education continues. And in not just the University of Holy Cross, but other universities and colleges and high schools and everything like that, how is the school system going to survive? How is the university system going to survive looking into next year?
Well, that's a wonderful question, and you phrased it just correctly. So a campus a physical plant doesn't make a university. A university is made of people, and students, faculty, and staff make a university community. And I'm so proud and thankful for the innovation, the quick adaptation that our faculty and staff and students have done during this time. Because the University of Holy Cross is open, alive, and well. It's just in a different way at this point in time. And so as we look into the future in the next few months and as we go through this time with COVID-19 and the pandemic, it's actually a time where our type of university, where we're mission focused, community centric, making sure we're providing top quality education to our students and also serving the larger world, that of course is in normal circumstances at a physical campus, but we're doing that even in greater spades. And what's happening with counseling is another example of that. So we're looking at various scenarios just like the government officials are doing in terms of how the next few months will play out. But one thing will remain constant, just as it is for the remainder of the spring semester. As we look into the summer and fall, I am completely confident that in whatever form, we'll continue to be open, and effectiveness of teaching and learning at the University of Holy Cross will continue to thrive.
Do you think, and I'm going to let you speak for other universities too, because I'm sure you're keeping close contact with other university presidents or what's happening elsewhere, are classes going to look different? Are things going to look different next year in the fall, do you think, or even for the next whole year of going to college, the college experience?
Yes, absolutely. I'm in a working group of the New Orleans 13 Greater New Orleans, 10 university college presidents and chancellors. We're in daily communication. Also, too, with our Louisiana Association of Independent Colleges and Universities. Prior to coming to serve as president of Holy Cross, I was president of that association, and that's the 10 private universities in our state. But also beyond that, it's public-private, 2-year, 4-year research universities, small liberal arts colleges, all of us on the spectrum. And we have different challenges based upon the nature and missions of our institutions. But one thing is we're all committed to is providing access to higher education for our students and working with our faculty and staff to ensure the continuity of that, and also supporting our faculty and staff as they have changed and adapted to provide that education. And so in the case of the University of Holy Cross, we of course will have a summer semester, as we always do. It may look what it looks like right now with online because of the nature of the virus and so forth, and that's to protect the health and safety of our faculty, staff, and students. And then also too, what's normally some things that get maybe a little bit detracted in the broader scheme of American higher education that are always strengths of the University of Holy Cross. We have a 10-to-1 student-teacher ratio, which is a big strength for us in normal circumstances and is a big strength for us moving forward right now in these challenging circumstances. It's always been great that our teachers know our students' names, but in this time of small gatherings or limited gatherings, that actually becomes a greater advantage for the University of Holy Cross and a bigger plus for us to educate students. And also to ease anxiety, knowing that in whatever form, a Zoom class, a telehealth, telecounseling session, or in the regular circumstance of returning to campus physically incrementally, where you can't have hundreds of students in a classroom, that works very well at the University of Holy Cross.
So I guess we'll see what happens next year. Okay, and in the summer, as a matter of fact. But thank you, Dr. McNeely, for joining us and giving us some insight into the, what's happening right now, and especially with this telemedicine or telemental counseling. Thank you for joining us.
Thank you very much, Gina.
Dr. Roy Salgado. Yes. Let's talk about the takeaways. We've talked about a lot of things, the anxieties, the loneliness, the different things that people experience, and how this program or this service is helping. What are some takeaways from this show that we can help our viewers with?
Well, it's important to realize that everyone is experiencing this at the same time. There's no one on the earth that has escaped this. We're all experiencing it, and to normalize that. And that this is a global macro-systemic issue over which we have little control. We do have control in our own individual lives, however. And just to take a breath, just to breathe, and to quiet your mind and realize you don't have control over much of what's going on, but you do have control over your person, over your mind, and over your body. And there's certain things that you can do to mitigate the bigger pandemic problem that we're all experiencing that's producing that stress and anxiety and fear in each of us.
So give us some tips.
So first of all, take that breath. Take that breath, quiet your mind, and just realize that this is bigger than any one of us. Also, to ground yourself. What do I mean by grounding yourself? To simply realize that you're safe now, you're in the space in which you're in, and you've eaten, hopefully, you've had your basic needs met. And so just realizing for now, for today, I'm okay. That this perceived threat, while a very real one and one out in our world, right now it's not here with me. Right now I'm safe, I'm in my room, I'm in my home, I'm in my space, and things are going well. Reflect on the good things in your life. Reflect on the things that are happening that are still good. And have gratitude, express that gratitude for those good things. Remind yourself throughout the course of the day of those good things. And just take the time to do that consistently. If you're isolated, reach out to other people. If you have many people in your home and you're stressed out because your family and your spouse and your kids, then take some time for some self-care.
Go away a little bit. Find a little space.
Yeah, go out into your little yard, garden, wherever it may be, and find that space.
Okay. Well, thank you very much for helping us through this, Dr. Roy Salgado from the University of Holy Cross. And we're going to do another episode of this and talk about more things with the way people are feeling and how we can deal and how this service may help them.
Yes, we're here to serve the community, and we're glad to do so.
Thank you very much.
Thank you.
And thank you for joining us. And until our next episode, we will be here to help you cope during the COVID crisis.